Hi everyone, Sheehan here. That's what she said. It is February 6th, Wednesday evening, around 11 p.m. And I wanted to come to you today to give you a brief update because I was able to see both my breast oncologist and breast surgeon yesterday, and things did change a little bit from the good news that I was able to give you the other day. And some things did stay the same. Now, to start with the good news that stayed the same, I was able to fully review my PET scan with Dr. Maida, my breast oncologist, and he went over, from the top of my skull all the way down to my legs and showed that the cancer definitely has not metastasized to any large areas in my body. However, when I met with both him and Dr. Brill, they as a team decided that it will be best for me to do the most aggressive form of chemo, the 3 types. They're going to start me on adriamycin and Cytoxan, and it will be once every 2 weeks for 4 weeks. Now, that adriamycin was the medication that we were trying to avoid because it has a 15% chance of causing a cardiotoxicity, which leads to cardiomyopathy, and about a 1.8% risk of leukemia. Now, the way I have to look at these numbers now is that they're actually very low when you consider how much they're going to increase my chance of survival and decrease recurrence in me. And as a woman under 40 and premenopausal, the most important thing now that we consider is not just 5 years from now, but 10 and 20 years from now. So I was really excited to give you that news that I was only going to have the 2 drugs because my onco score was only 10. That has changed. So I will be getting, after the first round of adriamycin and Cytoxan, that will take once every 2 weeks times 4, so it'll be 2 months. After that, they will start me on Taxol, which is paclitaxel, once every 2 weeks for times 4, which is another 2 months. It's ironic because paclitaxel is one of the drugs that we used to use inside of the drug-eluting stents in the cath lab to save a lot of our heart patients from having scarring come back in the areas they were blocked. Ironic that now it's going to be used for me in a different application. There is another way of administering this where they can stretch it out over 12 weeks, and that would only happen if I'm not able to tolerate the more aggressive version or in a shorter period of time. On to the next bit of information I wanted to give you was an interesting perspective that happened after my second fill. And this is really important for all of you women who have had reconstructive surgery. I want to show you, this is what I look like after my second fill. I showed you what I looked like after my first fill. But what was very interesting and unexpected for me was that I almost instantaneously had less nerve pain in my chest and increased my range of motion on both of my arms. You can see this now. Really amazing range of motion to have 4 weeks post-op. And again, ironically, that after the second expansion, it's almost like as the expander kind of unfolded, my body behaved well, responded well to it. So I wanted to let you know about that so you don't give up after your first expansion session. The other thing that I wanted to bring up is that although the pain's gotten a lot reduced, I still have random times like 8:30 this morning when I woke up with my chest on fire. And luckily it's not happening as often, but it does still happen here and there. one thing I wanted to mention is that Dr. Brill said that she was surprised that they hadn't heard so much from me post-op. And I think a big part of that is because of my home health nurses. So I wanted to give a shout out to Bayada Home Health. They've been visiting me every week and also sending occupational therapy, and they have been fantastic. I mean, every time I'm nervous about something, they're able to offer me either counseling or direct support. A lot of their team has undergone double mastectomies, and they are just like amazing home health nurses, and I'm really, really grateful for them. So that's also why MD Anderson and my team hasn't been hearing as much from me, because they've been managing me at home, and as I said, Dr. Buck has been managing my pain very well. Now, next steps. Tomorrow, I have my third fill with Dr. Brill, and I am very happy that my best friend Rachel is going to be driving me. I'm sorry, not with Dr. Brill, with Dr. Fahey. So after my third fill, I will be going to have my medical marijuana evaluation, which now that we know we're doing the more aggressive chemo is even more important because of weight management and anti-nausea. So after that, this Friday, I'll be having the portacath placed right here. And they put that in so they can administer the chemo directly, directly to where my heart is without having to go through your veins. And this stops your veins from being in pain and also swelling. On Monday, I'll be having my colonoscopy. And if all of that is cleared, then I could start chemo as early as the end of next week or perhaps the week of the 18th. Nervous as all heck, but luckily my dad was with me yesterday. And then when I came home, my mom picked up my brothers, Zach and Josh, and they came over and helped cook a meal for me and just keep me sane, because I was really upset last night. You know, it really is hard, you know, hard realizing that I'm going to have to go through this. Not trying to worry about losing my hair, but it will happen after the second session, so I'm definitely planning on shaving it off. It's unfortunate I can't donate it because I do dye it myself, even though I use all natural dye with no ammonia or alcohol. I don't think they're going to accept my donation. But very lastly, I want to give a shout out to Amy McClosky and all of the women at BSC, which is a part of my company, Boston Scientific. They have made their charitable partner for this year's national sales meeting, BRAS for a Cause. And I just want to thank them for bringing awareness to this disease and also helping women who have survived. I'm going to try to put a link in the bio for anyone that's able to make a donation. But lastly, we'll do a quick review to show you my progress on healing. And you can see that's where my drain was. Here's my surgical wound. This was that one extra lump, but it's looking better. Still a little bruising under my ribs. On the right side where we had the lymph nodes, you can still see what they call a cording. And my scar's healing up well. So I really attribute this to my diet, nutrients, and supplements. I'm so grateful for Chase bringing me fresh eggs. The protein from eggs is really, really crucial for healing. So I wanted to say I love you all. Thank you for following my journey and for all of your prayers. Man, I really feel them when I need them most. Thank you. I love you. Thank you to the whole prayer team at Boston Scientific, for my boss, Patrick, for putting me on the prayer team's prayer list. There's nothing like the gifts of God. And again, I know that there is a purpose for this, even if it's just me talking to you right now and having you do your own self-breast exam, because my lump was palpable. I could feel it. I did dismiss it as fibrocystic lump, like a lot of women do. I've had fibrocystic breasts my whole life. So I did dismiss it at first and didn't realize it was cancer. So it's crucial for you to be doing these self-checks and then have a constant dialogue with your physician. Not getting unnecessary mammograms, but even considering doing an MRI if you have dense breast tissue like I did, or ultrasound, which clearly showed that it was cancer and not a cyst. I love you all. Thank you for following me. Thank you for being with me. I hope you have a good night. That's what she said. Mwah.